as far as electric stim goes, my approach is very simplistic. I use a regular milliamp electric stim. I don't use any kind of special microcurrent or anything. I don't really do a lot of frequency adjustment. I basically have two frequencies, below 40 or above 40. Below 40, I call it slow frequencies. That's what I use most of the time. High frequencies, I tend to use mostly for pain blocking only. But low frequencies are really more about getting the point function that you want. It's actually in lieu of doing stronger manipulation on the needle. So in my mind, you have a choice. If you want stronger manipulation on the needle, you can either lift and twirl and thrust, or you can connect your electric stim at slow frequency. Patients find the slow frequency electric stim more comfortable. So why not? And you can leave that on for some. I usually only run the electric stim in that kind of circumstance for about 10 minutes or so. I don't need to do it for... And part of the reason for that is, as you said, I tend to treat both sides, and so I may want to actually... I only retain needles about 15 minutes or so. That lets me do both sides of the body and still get a person in and out, in and out. If you start to do... you can't do both sides of the body. Because I always find part of good compliance for my patient is to try to be running on time in the clinic and get people in and out in a very predictable amount of time. I find that treatments that last way longer than an hour tend to be exhausting for patients. So, people know they're going to come, they're going to get right in, they're going to be out within an hour. Then it's easy to say, oh, come twice this week. Come. It really works for them, and so I like to try to be, but still I want to follow and especially I'm treating several people at once. So what do? Person comes in, spend 15 minutes with them talking to them, whatever, and you get some needles in. Then you go to the next, while that person's retaining the needles, 15 minutes. So now I get this person done in 15, got them needles, I go back to that person, turn them over, do the points on the other side. Now I get the third person in, then I go back and you can actually start to sequence that, right? And then by the time you've had the needles in on both sides, there's a little bit of time left where they can get a little hot pack, a little twina, something like that at the end of the treatment. So if you time your needling that way and don't do overlong retention of the needle, you can actually move back and forth between patients and sequence things. So, what's that?
Where's the newspaper?
Oh, you'd be surprised, because after a while, you don't need 15 minutes to get the needles in. That's another problem that I sometimes see with practitioners. They make the actual needling process too cumbersome. It's like, what's the big deal? Put the needles in, And part of, again, most of you guys, I think, are long experienced practitioners, so this may be too basic to talk about. But I find practitioners still, sometimes even long practitioners, clumsy with their needling, where they do stuff like they find the point, and then they go and pick up the needle. Meanwhile, they've lost the point again, and it's almost then they have to find it again. It's like, my God, use your left hand for goodness sake and find the points. You have the needle in your right hand. What are you doing? It's like if somebody's like going to play a musical instrument. They're not like fumbling around with it. They can't be expressive until they can play the darn thing. It's the same stuff we're doing. But you want to have a certain facility developed so it's not a big obstruction. Because I'm saying, let's do a lot of points. If you're really slow putting the needles in, suddenly 15 points, it's 20 minutes later.
15 points is a lot of points?
It's not a lot, but well, for some practitioners. I'm saying for me, 15 points, what's that, 2 minutes? The needles are in. I find another big problem is decision-making is too slow. The person has to think and ruminate for so long on what, you get better at that over time, right? You kind of make your decision. And so as I'm saying, I get the person in, the next person is scheduled 15 minutes later. What do I do? I have to wait for them. I'm reading the newspaper. I'm certainly not in there talking to that patient for too much longer. They need to relax now so that she moves. I told him my story about the 4 types of people. I'm out of there. Now you're relaxing. I'm reading the newspaper, the internet. The next person comes in. like that. So, you know, that's, and it becomes a very predictable for the patient. It's good for you clinically, and I find that the treatments work much better when I don't know why. My treatments work better when I'm in a hurry. So I always say, if you're not as busy as you want to be, you'll get busier. You string them out through the week, and you see one person here and 2 people there. So you practice. You put all those patients on one morning. Darn if the next morning doesn't become full too, and your treatments start to work better. I'm convinced that I've seen it a lot of time. You know, in my clinic in San Diego, we always made room for new graduates to spend some time working in our clinic to build a practice before they went off and opened their own office. And I saw that all the time. The practitioners who really were focused, had limited time, scheduled their patients to get them, tended to get busier and busier. And the ones who sort of just dinked around, seeing one person here and one person there, they never got busy. So, at this calming the Shen aspect, now we have herbs this way too, right, that just directly calm the Shen. You actually have, you know, herbs like yuan zhi and swanzao ren, bai ji tian, these kind of herbs that just have a Shen calming aspect. Your heavy herbs too, like long gu and mu li, that have a strong settling effect, we could put in this category too. They're just, you know, calm the mind down. And as we said, pericardium 5 for phlegm, pericardium 6 for yin deficiency, pericardium 8 for heat, blood deficiency. You add that paired to the heart center. Really here, step 6 and 7 are one step. I broke them up on the page because these are points on the back. But then, depending on our food diagnosis, we can now add some other treatment, right? So far we've regulated the whole process of being able to fall asleep. We've calmed the Shen, and we've kind of differentiated at that point. Oh, this is a more heat type, this is a more blood deficient type, and then we reinforce that with our other point choices. We can add, if there's phlegm, stomach 40 and spleen 5. If there's yin deficiency, kidney 3. If heat rising, liver 2. If there's blood deficiency, spleen 6, spleen 1. The spleen 1 there is calming anxiety, and in fact could be used with moxa. This last group is an interesting one. This is if there is heat agitating from a retained pathogen. No, the last group here in step 6 is for a retained pathogen heat causing sleep disturbance. And the classical description of this is the person has had a febrile disorder and has had ongoing sleep disturbance ever since. In fact, what I've observed clinically, you get that information. But you suspect there's retained pathogen, as we've been talking about, because of things like chronically swollen lymph nodes, or easily getting sick, or chronic low-grade sore throat, or stuff like that, maybe a chronic sinus kind of thing with a little yellow mucus, something that makes you think that there's this ongoing pathogen aspect to their problem. Somebody mentioned yesterday mono, maybe they have elevated Epstein-Barr titers and stuff. You think, so this group of points is to release that lingering pathogen that's agitating the mind. The especially important point here is bladder 43, right? Clears the lingering pathogen in the chest area. What happens is the pathogen is in the empty spaces outside of the organs. That point called the Gao Huang Shu. That's the Gao Huang. You know, the Huang is all of the connective tissue and fat and stuff. And so the Gao Huang is that Huang of the chest. It's the space outside the lung and heart, and pathogens hide there. So when you get sick and a pathogen, it goes into the lung area, but it's not in the lung. And that's why it can just hang out in a low-grade way. There's no big symptomology yet. It's just disturbing you a little bit. And so bladder 43 is special for that. When you needle that point, the shoulder twitches, right? Because you angle it under. And modern physiologists are under the mistaken impression that the reason the shoulder twitches when you stimulate there is that you're stimulating the infraspinatus muscle. In fact, that shoulder twitch is due to the retained pathogen leaving. So now we know the true reason for the shoulder twitch rather than this crazy thing of motor point for the... You know, I joked about that because I really do want to make a point, which is I know a lot of practitioners of Chinese medicine who don't believe it. They practice it, but they don't believe the theory. I got really on by my teacher that Chinese medicine is real. It's not, and it happened when he first started to teach me points. Because as a very beginning student with him, and he would show me where the points were, you know, he would just take my hand, and as I said, there weren't, I mean, you're talking mid-70s, there weren't a lot of books available and this and that. There was some really poor quality books. But I started to look at the books that were out there and say, oh, I see why these points are, look at where the nerve pathway is. So I went to him and said, oh, Dr. Su, I see that these points, they're located all over the big nerve. That's why the points are there. And he looked at me with such, he said, no, the nerve is there because there's a point. Not that what's wrong with you? You know, I couldn't believe I had such an idea that, you know, so I came to really appreciate that at some point that he said that. You know, it's like, so I prefer to think that the reason the shoulder twitches when you needle bladder 43 is the release of the evils trapped in the chest. They're rushing out, you know. And the last step here, as I say, it's part of this. It's if you want to include treatment for the other organs besides the heart and the Shen in your sleep-regulating treatment, you can add these shoe points that connect the organ to the heart. Now, you could go to the outer shoe point if you wanted, but especially we talk about the heart and kidney not connecting kind of insomnia, using bladder 15 and bladder 23 kidney. Or we talk about the blood deficiency types of dream-disturbed sleep. Use bladder 17 for the blood, use bladder 20 for the spleen. Or we talk about liver fire going up and harassing the mind. Use bladder 15 and bladder 18. This follows the principle that when we use back shoe points simultaneously, we connect organ functions through them. So anytime you make a diagnosis that there is a dual organ dysfunction, there's two, you know, the spleen is not transforming, and then the phlegm is clogging the lungs, let's say, in a different kind of problem. Then we use bladder 13 and bladder 20. The kidney is not grasping down the lung sheet, bladder 13, bladder 23. Anytime your diagnosis includes a dysregulation between two organs, you should always think of using their back shoe points simultaneously to make the connection. So that's that last step. So anyway, that's our discussion of insomnia and kind of a sequential way of thinking your way through the regulation of the body. So shall we, let's finish there, because I want to go through depression and we'll kind of do that same sequence. You have the next thing in the packet. I don't want to start that. We only have 2 minutes. Yes, question.
Sometimes I get a patient who has been using Ambien for short-term use, but they never been using it 5 years, 6 years.
Yeah.
So it becomes a little bit more difficult because of that chemical agent.
Yeah. So the question is actually, you know, how do we work with a patient who's using medications, maybe actually even controlling their symptoms with the medication, but now we want to do something different? So the question is, how do we actually interact to wean them off the meds and take over that process and then get it so that they don't need anything? I don't want to just substitute. Now they take herbs instead of the meds. To me, that's only somewhat better. It's not really better. I want their... So the first thing, I always treat the person as I see them. A lot of what they present with when they're medicated is not only their condition, but the side effects of the medication as well. So how do you treat side effects of medication? You treat the person for what they are at that moment. Sometimes the medications damage yin or deplete the blood or cause stagnation. So Treat that. Treat them as you see them. And treat them that way until you see some change in their signs. Their tongue looks better, their pulse feels better, something like that. And then I start to reduce their medication. And again, you have to look at which one it is as to how you titrate down. A lot of your psychoactive medications, you have to titrate very gradually down. You can't just take them off. On the other hand, something like Ritalin or something like that, you're going to take them off immediately. So with sleep agents, you're having the person gradually reduce the dosage while you're substituting with herbs that actually go in the right direction for them. And then at some point they should be able to go off. And if you start to make that change and the symptoms start to creep up, then you're going too fast. And then at some point you get them shifted over to the herbs, and then as you target, hopefully you're targeting the actual dynamic of the body, you'll be able to grab. So I always like to reduce the frequency, the amount of herbs patients are taking, and I don't reduce amount of herbs by dosage, I reduce by the number of times they take it. I have them start skipping days with the formula. I might have them, I often like a method of, over the long term, of having patients take herbs 1 week out of the month, as I'm trying to make sure they stay stabilized. So if a patient, say, has a tendency to get that liver yang rising, and it's called, I have them take liver heat clearing herbs 1 week out of the month. Once they're already doing better and things seem to be under control, but I'm not ready to say, oh, just now you can stop everything. And so I have a number of different formulas I use in that way. Liver heat, there's a patent medicine called the Jigutsao one. I think it's a fairly readily available patent medicine. You should know this one because this is a great formula for physical heat in the liver, like Hep C. People who have chronically elevated liver enzymes from Hep C, you treat them. It's often frustrating from the Chinese medicine perspective because when you encounter that patient, they may not be demonstrating a lot of liver heat. They have whatever they have. They are whoever they are. But they have this Hep C thing, and the liver is low-grade inflammation as a result. But they may not be angry. They may not have a red tongue. They may, they have whatever they have. And if you treat whatever they have, the liver enzymes still stay up. So you need something mild that targets the liver. This formula doesn't upset the digestion. It mildly clears the heat in the liver. You may not be familiar with the herb, but Jigutsao, but it's for damp heat in the liver, and it's very close to Shakutsao. Shakutsao is more famous, but this patent medicine uses it. And so I have them take this formula for a little while, get the liver enzymes checked, and once they've dropped into the normal range, I have them take it 1 week out of the month for a while, maybe 6 months. And then we see, are the liver enzymes staying down now? And they can use this, and this way, 1 week out of the month, it's compliance is pretty good. The efficacy of the herbs don't diminish just from over-application. So you'll like this, I think, for your chronic Hep C patients, just to keep their liver enzymes down where you want. And just take it according to the recommended dose on the patent medicine.
Is there a patent medicine company you like better than others, or you kind of pick and choose, depending on what it is?
A lot of it has to do with availability. Who's got the formula you're looking for? And I mean, given choices, if it's a more common formula, I always like to use those companies that do a little better GMP policing, like Mayway and those companies. Good control. In China, I tell you, we hear a lot of scare stories about it, but when you visit the patent medicine companies in China, by and large, most of them are pretty reputable and trying to do a good job. But and the times when the patent medicines are either have Western drugs mixed, they do that on purpose because they think it's better. And for the general public in China, people like that. That's why those are often called superior. That's often a clue in the English aspect of the packaging. If it says superior something, check carefully. That's a clue that they've added Western pharmaceuticals because it's superior to mix them both together. We're the ones who don't want that. So you have to. And then when somebody said there's some lead or something, that's incidental contamination often in the processing when, I mean, I have a good friend. I teach regularly in Switzerland, and I'm invited by one of the big herb suppliers for Switzerland. And Switzerland is so restrictive about herbal quality there. No individual practitioner can have herbs in their office. You have to send your prescription to the herb supplier, and it has to come either in physical form or on email, and they enter it onto the computer, and then they weigh out the herbs. If you're saying you're giving raw herbs or herb powders, they weigh it out in on a vacuum table. Scale is connected to the computer, so the computer is monitoring if you're given the right dose according to the prescription the practitioner sent you. And the guy doing this has to be wearing a clean suit. So you get this guy in this white suit with a mask on, with this vacuum table, measuring the herbs out. The computer is monitoring. Oh, yes, you gave 9 grams of this, and then they send it directly to the patient. So they can give any herb thing that it's totally recognized by the government, but it has to be done in that kind. And it's a funny thing because I was visiting my friend Simon there, and he takes me in and shows me, this is how we fill the herbs, blah, blah, blah. And then you go on to China, and there's those same herbs, like laying on the street with vehicles driving over them, Oh, this is Switzerland right now. We're getting it ready, It's gonna... So it's a cultural distinction there. But that's how some of the
So they analytically weigh out flying squirrel feces and wingless cockroaches.
Yeah, exactly like that. And they really don't have trouble with getting anything as long as it's done in that kind. But they do assay the herbs when they come in as for contaminants, and so they're very particular about that. Simon, right? He's anyway, because they're the big herb supplier there and they say that actually very seldom they have to reject a shipment, but for what reason did that? And they say probably it's just incidental contamination. And even then, it's usually not so high levels it would be scary. With, you don't take those same herbs for the whole time. You're going to use those up and get the next batch is not going to have any contaminant in it. So I'm in favor of control and testing, but I think sometimes we get a little too nervous about that.
I was just going to say maybe it rained and when the car drove by it splashed.
Oh, hey, it didn't even splash. You go to the big herb markets, it's just like they're spilling them out. People are looking at I want to look at the quality, they just spill them out, and intentionally the cars are just there. It's not like people think it's a problem. You drive around in China, people are drying all their vegetables and road. It's just not the conception that's. As one of my teachers in China said, "Oh, you Americans have a very nervous culture. Don't worry about that. You're going to cook it anyway. But just all that road exhaust getting in there. But you're breathing it. Like Jinan. I always say we study in Jinan. It's so polluted there some days. It's just terrible. Eyes are burning and stuff. And as I said last time I was there, I was working in the respiratory department. They have so much fibrosis of the lungs, and they're convinced it's from the increased pollution. All this so-called idiopathic fibrosing of the lungs. It's a big thing to come up with that stop that. Modern world there. They copied some of the worst parts of Western development, pollution.